So this section, 12.5, is on interactions between the drug and the host. So going back to my original drawing, we have the microbe, and we have its interactions with the drug and how that impacts then the host. And all of these interactions are important. We are going to look more at what the host does to the microbe in another chapter and what the microbe does to the host in another later chapter. Mainly, we're looking at the microbe-drug interactions, and that goes both ways, and the host-drug interactions. So what the interactions here basically between the drug and the host is this section here that we're really looking at in this section. So how does it affect us? The interactions basically fall into three major side effects and or drugs. So if I ask you, what are the three major side effects of drugs, this would be it. So toxicity, allergic reactions, and disruption of the microbiota. So disruption, it's really messy, but you get the idea. So toxicity, allergic reactions, and the balance, disrupting the balance of the microbiota. So first of all, toxicity. We've kind of alluded to this. There's the liver toxicity, kidney toxicity, hepatotoxic with the liver, nephrotoxic with the kidney, cardiovascular system, gastrointestinal, like tetracycline had a gastrointestinal side effect. Sometimes they affect the nervous system. They cause seizures, as we saw with Cipro, or the quinolones, and then cardiovascular system and blood-forming tissue. So this is an issue with the chloramphenicol. Which is probably not used as much anymore because it causes aplastic anemia. Which is where you don't make any blood cells. So no red blood cells, no white blood cells, no platelets. It affects the stem cells in the bone tissue, you know, the bone marrow. And so it's going to affect their ability to make those. And that obviously, this would hurt the immune system because white blood cells are all they're all from the same basic stem cell, and then they split off into, well, that's not true. There's several different stem cells, but in essence, this would affect any of the white blood cells or red blood cells, and that's why it's called anemia. It's like if you're having low red blood cell count, then that's part of the anemia. Respiratory tract is sometimes affected, skin, teeth, and bones. This is like what we saw with the tetracycline and how it causes striping in the teeth, and I think we have some pictures of that. So this is a list of some of the major toxicity issues with the different kinds of drugs, and I'm not going to have you memorize this, but it is something you'll probably do in pharmacology. So things to be looking out for. But I think some of the more common ones you probably are familiar with, the fact that it causes diarrhea if you take the tetracyclines, and tooth enamel reacts into the sunlight, so you can't be out in the sun very much while you're taking tetracycline. Other kinds of things. Kidney function. I think rather than memorizing a list of these things for our purposes, I just want you to know what some of the different things are that can happen, that can cause problems. Like the cephalosporins are great, except that sometimes they inhibit platelets formation, so you may have difficulty clotting your blood, decreased circulation of white blood cells. It may impact your immune response. Nephritis causes kidney issues. Sulfonyl drug, these are all those things that they list in the commercials, like do not take if you have blah 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 blah, or basically you're like, after you hear all the list of side effects, you're like, why would anybody take this drug? But Anyway, don't memorize this chart. It's just of interest if you want to look at that and see what are some examples. So tetracycline is the main one we'll probably talk about. It binds to the enamel of the teeth, and it causes this permanent gray kind of tissue, or brown gray discoloration or brown discoloration. It can cause liver damage in women, pregnant women, and it can also cause the placenta, cross the placenta, and cause problems with fetal bones and their teeth. So you don't want to have this, but even after the baby is born, they don't want to give it to children, because if they haven't had their full adult teeth yet, then it's still developing their full adult teeth, and it can cause problems. So diarrhea is another common problem with a lot of oral antibiotics. Allergies. So now the second major cause of side effects is allergic responses. So this is the second big one. And as I said earlier in the videos, there's like 30% of the population is allergic to penicillin. And basically we'll talk about how that works. It's a type 1 hypersensitivity, but we'll talk about how penicillin and other drugs, how you become allergic to them. But it is just like any other allergen. Some people are allergic and some people are not. And we don't exactly know how that works, but we do know that it stimulates the immune system to make an allergic response. So it's like an overreaction of the immune system. It's allergic to something. It's reacting to something that is not a pathogen, but it is provoking the immune system to create this inflammatory response. So the other thing is suppression, and this is the third one, suppression and alteration of microbiota. So when you take a broad spectrum antibiotic, it treats the infection, that's the bad guys, but it also destroys your normal microbiota, which are the good guys. And when you have good guys in there, they have some importance in developing, and there's some real reasons why we want them there. They help with digestion, and they keep the bad guys from, getting too powerful or becoming too numerous. And if you remove all the good guys, if there's no good guys left, then all you have are the bad guys, and that's not good. So they take over the immune system, and they don't have any competition, or not the immune system, but different systems. And since there's no competition, they just grow out of control, which is called a superinfection. So when the microbes that were once small in number begin to overgrow and cause disease, and this is like a C. diff infection, is oftentimes caused by a superinfection. You could have a yeast infection that's also caused by a superinfection, because you've gotten rid of all the good bacteria, but not the fungus, the yeast. And so they then can grow out of control because there's no competition. So this is showing you just like one bad apple, but everything else is destroyed except for the bad guys, and now the bad guys take over. And so the pathogen overgrows and creates the problem. So describe the three main categories of adverse reactions to antimicrobials that would basically fall into either toxicity or allergic reactions or disruption of microbiota. And so what are some examples of toxicity? Effects by antibiotics, toxic effects by antibiotics. It would be like damage the kidney, and that's a lot of those like cell membrane inhibitors like polymyxin B. That would be oftentimes a problem. Damage to the teeth and skin and bones, that's your tetracycline. We talked about seizures earlier in one of the discussions, like Cipro can cause dizziness and seizures. So those are just a few examples of toxicity. Quinines can cause the hearing loss. So this is more of a nervous system thing. And so quinine can cause hearing loss. So these are a few we talked about, so I don't know that you need to know every single one of those, but these are ones that we talked about with more of the common antibiotics. So what's one of the more common antibiotic allergies? And we would probably have to list penicillin here, and the penicillin type drugs. So that's about 30% of the population, it's estimated, is allergic to the penicillin or one of the penicillin groups. Overgrowth of microbes due to antibiotic therapy is known as a superinfection. So that's all for chapter 12, and I hope this was very helpful to you. We'll talk about more of this in class just to discuss some case studies, but otherwise this is all for chapter 12.